Nasal cavity is divided into two by nasal septum. Problem arises when it is not dividing it symmetrically, leading to a condition called DNS or deviated nasal septum. Causes of DNS. There are four important causes. Number 1. Any abnormal pressure applied on nasal septum results in deviation to one side or another. Example, being hit by a boxer on the nose. Number 2 is developmental or abnormalities acquired during formation of the septum. Example, palate forms the base of the nasal septum. If palate becomes high arched, then automatically nasal septum deviation will occur. Number 3 is racial. Some races like Caucasian have more incidence of DNS. Number 4 is hereditary. Some families have more incidence of DNS. Types of DNS. 1. Anterior dislocation. The nasal septum is dislocated in one of the nasal chambers. 2. C-shaped dislocation. Septum is deviated in a simple curve to side. Compensatory hypertrophy of terminate occurs on the other side. Number 3. S-shaped deformity. Nasal septum shows S-shaped deformity. This results in bilateral nasal obstruction. Number 4. Shelf-like projections. It touches lateral wall and may give rise to headaches. Clinical features of DNS. The clinical features of DNS can be simply remembered by using a mnemonic called as NASEM. N is for nasal obstruction. Naturally occurring any deviation in the nasal septum causes less nasal space and results in nasal obstruction on the side of DNS. A is for anosmia. Patient is unable to smell as there is failure of inspired air to reach the olfactory region. Loss of smell may be partial or total. S is for sinusitis. Since all the sinuses have openings that is in the lateral wall of the nose, DNS causes pressure on these openings due to nasal obstruction. E is for epistaxis, and again E is for external deformity, particularly in young females or males who are more conscious of this. M is for middle ear infection. DNS also predisposes to middle ear infection because the eustachian tube, which is the only drainage source of middle ear, open in the nasopharynx, and DNS causes its obstruction resulting in middle ear infection. Treatment. Minor cases of DNS requires no treatment. If the symptoms are severe, then on reaching the age of 17 years can opt for septoplasty, in which the most deviated part of the nasal septum are removed and the rest of the septum is corrected and repositioned using silastic. A more radical form of surgery is submucosal resection, in which mucosa and mucosal flap overlying both the sides of the septum are lifted and most of the septum is removed and the flap repositioned.
In your head, 'cause you've been around.